Welcome to Itch Your Health. Philip Benyo with Philip Benyo, also known as the Fipster, bringing you the latest and greatest in healthcare information. This is the fastest half hour in television land out there. Remember, you're watching Itch Your Health, your leader in healthcare information. Make sure you check with your healthcare provider before doing any of the things that we talk about here on Itch Your Health. We'll be right back after this brief commercial message. Welcome back to the first segment of It's Your Health. Philip Benyo with Philip Benyo. So what's new in the headline issue there?
Let's start working through them. All right.
Yes.
Estrogen microdoses did not boost melanoma risk.
You got to tell me more about this one.
Well, for women who are on higher doses of birth control that had higher doses of estrogen or estrogen replacement therapy, at those higher doses there was an increased melanoma risk, but they were able to show at the lower doses that indeed there was no risk. And it's been decades long thought that it would increase that risk, but it turns out it doesn't.
Right. Well, obviously, artificial or natural hormones that are taken internally can do other things as well. So I think you need to go low, go slow, and try to get off these medications. It's not like you can be on these agents forever.
Moving on. Dietary carbohydrate and glycemic load are linked to acne.
That's very interesting because when we were growing up, we had a dermatologist in town, Primo Mori, believe it or not. And when you went to him with your acne, he had a infrared light or something that would used. But he also often talked to us about junk food diets. You know, we thought chocolate and things along those lines made your acne worse. And you're saying that's true.
It certainly does, and it just doesn't have to be pure sugar. Things that are really high in carbs or high glycemic index, that's actually listed on the food label now, those things will certainly aggravate acne. Moving on. Newest American College of Physicians guideline. It's more of something we've talked about before, but keeping your blood pressure below 150 systolic for our elderly, really over 65.
Right, and that's tricky because a lot of these elderly patients are on a number of prescription medications that can affect their blood pressure, and we don't want them to be going from sitting to standing, lightheaded, dizzy, fall, and break a hip. So they've relaxed the guidelines. For you and I, our pressure should be around 120 systolic or less. But after 65, we've relaxed that a little bit, so you're allowed to go up to 150. At least that's this year. Who knows what next year brings?
Yeah, from a cardiovascular benefit, it certainly does benefit you to have a lower pressure. But from an all-cause mortality, definitely does not. That's where we get into trouble. And it's really, when we look at our elderly, they're at a point where they've lived long. They just want to live independently, and what'll ruin independence is a fall.
Yep, no doubt.
So speaking of tough topics, hard topics, things that are hard to get through, hard to move. Let's, for a minute, talk about chronic constipation.
Oh, that's ugly, yes. Well, again, going back to medications, a number of medications can affect bowel function. As we age, we don't like to hydrate ourselves. So relatively speaking, we're camels. We don't add enough fiber or drinks to our environment. There are medical conditions. For example, if you're low on thyroid, you can be constipated. If you're on pain medicines, obviously, you can get constipated. What have I left out here, Fipster?
That sums up it doesn't have to be necessarily that I don't move my bowels. It can be that I'm always having a very hard time or they're very irregular. Certainly if you're having changes in bowel habits, that's always worth talking about, not just assuming you're constipated. There's a lot of other medical conditions that could be going on. We'll talk about some of the ways we look into that later. But usually kind of the first, second, and third is, it's hydration, lack of fiber, and then medication. What are we doing to make it worse in the medical industry? And so there's a lot of different ways we treat that. Dehydration is very easy to solve. We just drink more fluid. Adding more fiber, we can try to eat more green leafy vegetables, more fruits. If we need to add a fiber supplement, we can add FiberCon. Sometimes we have to add some other osmotic things such as Miralax that help trap water in our bowel. For the people who have the opioid or narcotic-induced constipation, they're a bit trickier. Sometimes we require specific medications that will block the opioid from actually hitting the colon. That's one of the trickier ones.
Yeah, one thing to keep in mind is that constipation can beget constipation, because if you are used to taking stimulants to cause the bowels to contract more, after a while the bowels say, I'm not doing this anymore, I'm tired of it, so you get more constipation as a result of using a bowel stimulant, so stay away from those.
Yeah, I like things that are osmotic, things that help trap fluid are great. The stimulants are certainly, they're a get out of jail free pass. You shouldn't go to them too often. And I think the biggest one on that list is the quote natural vegetable laxative that everybody loves, Senecot. Well, that's natural, I should be able to take that. But that actually your bowels can get addicted to, and there are reports of people who have got used to taking that every day, they go ahead and stop it, and all of a sudden their bowel stops. And now they need a partial colectomy, or I think we had a patient years ago that happened to.
Exactly, yes.
It's a real nightmare, but certainly avoidable.
Moving right along.
Well, that's good. Let's for a moment talk about, it's the time of year people are getting vaccinations. Seasons change. We start seeing some fun rashes. What's one of the most common rashes we see as these seasons change?
Shingles that comes to mind. We just
That's
saw a
right.
few cases.
Absolutely. Shingles always kind of comes in clumps. You never see just an isolated case, although it's not catchy per se. It seems to always be around the same times of the year. Really, we always have talked about how to treat shingles once you have it. That's easy. We need to identify it early and get on medication early. But really, shingles is now about prevention. It didn't used to be, but we have a vaccine that will really help prevent shingles. There's even newer vaccine coming out that'll even do a better job. But it is very underutilized. I'd say easily less than a third of our population over 65, over 60 really, where it's indicated, have had the shingles vaccine. And that's sad, because you talk to someone who's 65 and older who's had shingles, and it can be a life-altering disease.
Right, that's all you have to do is be introduced to someone who had shingles and the pain thereafter, and it's a living hell.
Yeah, so certainly worth talking to your healthcare provider. Look into the shingles vaccine, depending on your age group. Sometimes it's easier to get here in the office. Often if you're 65 and older, it's easier to get at the pharmacy. It is an expensive vaccine, but it's very covered by your insurance.
Yep.
Worth looking into. Lastly, let's talk about something fun. Look at this picture. You ever have a patient come back and tell you they got a burn while they're getting an MRI?
That is unbelievable, and that's probably why it's in the journal as a reported item. I've never seen anything quite like that. What happened here? Well,
I had to read about it. Very interesting. From a physics standpoint or an electromagnetic standpoint, it makes sense. What happened is this person, their legs were touching while they were doing the scan, and usually they put a sheet to kind of keep skin from touching other skin. But what happened is this part of their body kind of touched, and it created a loop. And an electrician would call a loop a circuit. And anytime you have a closed circuit and you provide a large amount of electromagnetic force, or EMF, you can induce a current. And a current is another word for electricity. And so what we're able to do here, and this patient unfortunately, is they induced, because of the way they were touching, they actually induced an electrical current through their skin that created second-degree burns. And MRIs put off a lot of magnetic radiation, and so they can probably produce some pretty high currents depending on how closed the loop is.
That's unbelievable. Well, we told you it's the fastest 30 minutes in television land out there. We'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. Be right back. Welcome back to the second segment of It's Your Health. Philip Benyo with the Pipster, all-knowing, all-telling, as you will find out.
All right, moving along with the headlines. Statins get a big press. We push statins really on a lot of different people, but recent studies showed that there is no benefit to statins for primary prevention in the elderly.
So what does that mean? If I'm 65, I have no heart disease, and my cholesterol's high, I should or should not be on a statin?
I think you should be on a statin to help lower your cholesterol. That's an indication. as you know, in some people, like diabetics, for instance, whether your cholesterol's high or low, we use statins for primary prevention to prevent stroke and heart attack.
Right.
It's the number one thing that happens to diabetics. Even in people who have had heart attacks, we use statins to prevent secondary heart attack, even if your cholesterol's okay. So if, so we use it in primary prevention a lot of times, but what they're saying is that, at 65, 75, 85, what's happened already to your arteries has happened, and that's hardened and calcified, and going on a statin probably is not going to reverse that process. Certainly can prevent some worsening, but maybe the risk versus the benefit may not quite be there. So seeing some 80-year-old patient who we just identified has high cholesterol, they've got this far in life without having a problem, do we put them on a statin? I could see the argument for why not.
Let them have some Dago Red and aspirin and go on with their lives, right?
I guess so.
I guess so. That's what I'm going to do.
Vitamin D supplement may reduce respiratory infection risk.
Everyone who we measure or have been allowed to measure vitamin D levels, they're in northeastern Pennsylvania, they are always low, always. And so there's a lot of reasons for that. Of course, we're not out there in the sun a lot. But vitamin D has really been gangbusters in terms of preventing issues, more than just bone health, by the way. And I guess this is one of them.
Yeah, I thought that was very interesting. Certainly, you can always get away with taking, a few thousand units of vitamin D, but always remember, you really should think about talking to someone about how much to take, because vitamin D is a fat-soluble vitamin, so you can build up high levels, and that can be toxic. And there are some rare thyroid or parathyroid disorders, or people who have underlying kidney dysfunction. Sometimes they can store too much vitamin D and get themselves in trouble.
Yeah,
so keep an eye.
I usually take 1,000 units daily if you wanted to start at a place. And it's in my fish oils, by the way, so I get 2 for 1.
Oh, that must be some good fish oil.
Yes.
All right. Last headline, this is certainly very seasonal this time of year. Extended release of Wellbutrin or bupropion is being used now to prevent seasonal affective disorder.
The SAD syndrome, and I have a theory about this, but it occurs as we approach the fall. It gets darker earlier, darker longer. It's a little on the cool side. And my theory is that it has always been associated with separation anxiety. What does that mean? Since kindergarten, going to grade school, elementary, the September time has been a time where you're separated from your family, off to college. And throw in all those other factors, and I think that's the recipe, perfect storm for the seasonal affective disorder.
All righty, so we're going to do something really new, because we've been doing the show a long time.
Right.
And sometimes I can't watch myself on TV, but when I catch a glimpse, I see we're a little dated. So there's a new word. I didn't grow up with this word. It's called unboxing. Have you ever heard of that?
I've never heard of unboxing.
If you have kids at home or grandkids, ask them what unboxing is. And my kids, they'll watch videos of people just opening things.
Is that right?
And they call them, and my little kids will come running and say, "Daddy, are you going to unbox that?" And I'm like, well, maybe open it, yes, but no, unbox it, no. So today we're going to talk about the Cologuard.
Yes.
And what the Cologuard is, and we're going to unbox a Cologuard, kind of show you the contents. This is an unused Cologuard.
Thank God, yes.
And so for a moment, why don't we just talk about what Cologuard is?
Well, colon cancer, probably the #1 colon cancer in our region. Most people would be advised to have a colonoscopy to look for polyps, pre-malignant conditions, or a cancer in and of itself, because it's a silent disease, and by the time you hear about it, it's already too late to deal with it. So this is something that, like a mammogram, screening will help you to prevent further problems by catching a cancer before it goes off to the races.
Yeah, so colonoscopy is obviously the gold standard to look for colon cancer. There's a number of other tests that are out there that just don't hold the mustard. This is the first test that really showed us some decent clinical data to look. What this is basically a stool collection test. There is no prep with this. There's no sedation. There's no actual scope. This is something you do at home. You get this test, and you collect a stool sample in varying different ways, and you box it back up and you send it right back, and they actually do a DNA analysis. Now, that will pick up it's 92% efficacy rate. There is a 8% that will fall into, they'll get what's called a false positive, meaning the test is going to tell them they may have colon cancer. That means that they have to go for a colonoscopy to see whether or not that's
right.
true or not. The test is designed to get people to make sure that they don't have colon cancer. It's never going to tell someone they don't have colon cancer when they actually do. So let's unbox it.
All right,
let's
unbox
see what it
this
is.
thing.
So come with this pull tab my staff ripped out already because it's really strong for us to do. We're going to open this up. We're going to see a bag in here.
Okay.
Let's open that up. What do we have here? We have shipping labels and a lovely instruction there. I'm going to give that to you to look at.
All right.
So the first thing we have is this lovely toy, place under seat. Where do you think this goes? Here, you play right there. You hold that. Look at that.
It's not on your hat here.
No,
I
the
guess.
second
Okay.
thing is you got a nice big vessel.
Alrighty.
You can guess what goes in here.
Okay.
This is where the poo goes. We're going to drop that in there, and look at that. Now we can, that might not be big enough for you, but you're going to have to make it work. After you have tried to fill that up, they have this solution that before you put that in, take a couple stabs. This is a little different type of sample that's fresh.
Sure it's dead.
Yeah. You're going to dump this preservative in there, give that the toss, and all we're going to do is remove said. Hopefully you didn't make a mess of this whole seat. And you're going to just ratchet this thing down. Now you don't want to just like put this away like you do your soda in the fridge where it's half open and you lose the fizz. You got to really put a torque on this. And you're going to put that back in there. There are some labels there for your name.
Right.
You're going to zip it up and you're going to close it down. Now we just had the company in to talk to us about this. You close it up, you tape it up, put the sticker. They're going to mail it back for free. They'll pick it up. What kind of, how are they going to send this back?
You tell me.
They'll pick it up at your house.
Alrighty.
So this thing will get analyzed. A couple of days later, we'll get the results back, and I'll go over the results with you. Certainly, is it better than a colonoscopy? No, it has some limitations, but it certainly is better than doing nothing, which is what a lot of people are doing now.
Now, who pays for this? Will Medicare pay for this?
Medicare pays for this. Most insurances, Highmark, Blue Cross, Blue Shield just picked up on it. Humana picked up on it. Geisinger picked up on it. They're seeing that the data on this is wonderful. To help identify people with colon cancer early is the key to receiving treatment and being cured. Letting it go is what's really causing a problem.
Right. It's better than nothing, but it may not diagnose other conditions like colitis or pre-malignant polyps or things along those lines. That's correct?
Certainly not colitis. The pre-malignant polyps, I still think the jury's out on that a little bit. It's a screening tool, not a diagnostic tool.
Right. Very good. Wow. Talk about a jambut. That completes our second segment of It's Your Health. We're going to be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information and potties. Welcome back to the third and hopefully final happily segment of It's Your Health. We're moving right along. It's pretty hard to top this, if you will, after the Cologuard extravaganza, but we'll try.
Arrhythmia patients have undiagnosed obstructive sleep apnea.
You know, this is really an interesting topic because it's sleep apnea is underdiagnosed, undertreated, and can lead on to many strokes, cardiac arrhythmias, hypertension, pulmonary hypertension. It's unbelievable. The list goes on and on. So you really need to look at that. One of the markers of obstructive sleep apnea, besides snoring, daytime fatigue, is your neck circumference. If it's 17 inches or greater, chances are good that you have sleep apnea. So look into that.
Yeah, we're running into that. A lot of people with CDL physicals are getting upset. Well, there's a reason they come up with this data. If you're a certain size and you have a certain neck circumference, chances are you have sleep apnea, and it's certainly worth treating. Arrhythmias is one. If you end up getting arrhythmias as a result of OSA, you know, that's something you're going to be dedicated to medications and blood thinners for the rest of your life. And you know, the arrhythmias are what causes sudden cardiac death. Right. You know, that's how people just drop. Next headline: ibuprofen packed, the biggest blood pressure punch among NSAIDs.
Well, I'm not a fan of these drugs. You know, they really need to alert the public out there that this ibuprofen is not a benign over-the-counter medication. It is salt retentive, has side effects regarding your stomach, and most likely will affect the renal function as well, which will affect your blood pressure. So it's actually pro-inflammatory agent, despite the fact that it's anti-inflammatory. It has stroke and heart attack risk factors, and it really is overutilized and a dangerous thing.
Absolutely. You know, people really don't realize the dangers until they're knee deep in it, and all of a sudden they have big time kidney problems or bleeding, and a lot of those things are difficult to deal with.
Yep.
Let's keep hitting the NSAIDs. Exercise topped NSAIDs for knee arthritis.
Maybe not surprising. We're seeing a tsunami of osteoarthritis and knee pain in baby boomers, inactivity, weight, the list goes on and on. But of all the things you could do, exercise is going to help it more than a medication. So before you go off to knee replacements and shots, you might want to consider it.
Absolutely. So let's talk about exercise. You know, some people, they'll say, you know, for the week, I'm too busy for the week, I just can't do it, but they're labeled weekend warriors. They're out doing Spartan dashes or warrior runs, Spartan runs. They're making up for the entire week on the weekend. Let's talk about the positives and negatives of that.
All right. Well, it's not me. I'm not a weekend warrior because
you cut the lawn on the weekend. You know,
I do that. But you know, life is to enjoy, and to me, exercise is somewhat painful. But nevertheless, you need to get out there and do something. So, what would you recommend?
Well, there's been some data that suggests the weekend warriors have higher injury rates, and a lot of that has to do with not respecting the warm-up process or where your body is. Certainly, if you're a couch potato running a 5-mile Spartan race, you're probably going to get hurt for your first time, but you have to build up to that. But there's actually some data to show that putting in some vigorous exercise, 75 to 150 minutes in the weekend, just 2 days a week, is going to help lower your all-cause mortality 30%. You know,
wow, that's impressive.
And when you combine the fact that you're not going to get out of breath playing with your kids, you're not going to huff and puff running up the stairs or pulling out the weed whacker, there's also that what we don't really look in the data, but look at the quality of life.
Yes.
You know. Certainly that's a helpful thing. So I think it's okay to sit and, you know, do the boot camps and kind of push it hard on the weekend. You know, you have to kind of live life to the fullest. And for some people, exercise, I get that, they don't enjoy that, but then they have to accept some of the other drawbacks, or really kind of kill it in the diet and really watch what they're doing, so that they can have that life that they want to have.
You know, I guess I just look at it a different way and say, why should I do something I don't like that's painful so I can have another year or two in a nursing home? So, I don't know. It's the quality of life issues.
I'll disagree with that on so many different levels, but we'll move on. Let's talk about exercise and bone health.
Yes, very good.
Bone health in general. What do we need to do to boost bone health? What are the things that knock it down and the things we need to do to make it better? First off, smoking.
Absolutely.
What do you think, yes or no?
That's bad.
That's bad. Okay, good. Smoking is bad. I don't know if we've covered that before. But smoking certainly decreases bone density. Let's talk about soda.
Soda, absolutely. Yeah, the carbonic acid has some way of dissolving your bones.
Yes, absolutely. Whether it's diet, the dark colored sodas usually have phosphoric acid. That is going to leach your calcium right out of your bones and increase osteoporosis. Let's talk about diet.
I don't know. Let's talk about diet.
Well, high calcium, low calcium, good vitamin D, bad vitamin D, watching your diet in general.
Okay, all the above. Obviously, you want to get into the fruits and veggies, hit the dairy, which would have calcium and vitamin D in it. I think inactivity is another big thing for bone health. I think the one thing to consider doing, if we took all diseases like the top 3, cancer, heart disease, stroke, they are dwarfed by osteoporosis. Osteoporosis is out there more than those common illnesses, and which means it's underdiagnosed and undertreated. So you ought to consider getting a DEXA scan, which Medicare will pay for every 2 years, male or female, to see where your bone health is. And that can actually predict fracture risk 5 to 10 years out. So that's very important.
All right, let's play a little picture game. A guy came in with a rash on his feet. He went to an urgent care, not knocking urgent cares, but they looked at it and says, oh, maybe you just need some steroids. They put you on a Medrol dose pack, and because you know people love steroids, they cure everything. You come back, patient ends up making an appointment to get down to our office, and they see this just cherry red itchy foot. They're just destroying themselves. What do you think?
That looks like something you'd pick up in the gym in high school.
Right. So classically, this is athlete's foot, tinea pedis. Steroids are sometimes what are often used, whether they're topically or orally. And unfortunately, steroids immunosuppress. They slow down your immune system to fight something. So when we don't allow our own immune system to fight something, what's going to happen when it's there?
Yep, it's going to take off.
And so here we are. This is something you treat with an antifungal. Take a look at shoes, make sure they're nice and dry. You're changing your socks. And you can usually clear this up in about 2 weeks.
Yeah, it takes time.
All right, next picture. We have a young lady in her 40s. Has had this rash on her face for on and off for a few years. It never seems to go away. She drinks alcohol, it gets worse. Has spicy foods, it gets worse. Exercises or is out in the sun a lot, it really can flare. Has tried makeups, that doesn't make a difference. What do you think?
I would circle rosacea, Phil.
All right, what do we do about that?
Well, usually we would try to watch those things you just mentioned: stress, alcohol, sun. And Metrogel is usually what we use topically.
That's something we can use. Sometimes it's worth, the dermatologists now have been using really low dose minocycline preps that you take for a long period of time. Not something we really manage here, but you have to be careful with those. But they will do usually a nice job, and it's something that you can't just look to us for the answer. You got to look to yourself. You got to look at the alcohol intake and look at the things that could be aggravating it, because it's often, although it's a condition, it can be aggravated by a lot of exuberance in life.
Speaking of exuberance in life, we've just completed the third and final segment of It's Your Health, the fastest 30 minutes in television land history out there. Thank you for allowing us to come into your home, hopefully to inform and entertain. Inform is a new word, right? Inform and entertain. Again, thank you, and keep watching and go from there.